Hello everyone. Today we will be discussing withdrawal babies, also known as neonatal abstinence disorder, and these are the concepts that we will be covering in this video. Enjoy! Meet Jane, an expecting mom, thrilled to be having her first child. A few weeks before she found out she was pregnant, she had gotten a leg injury and had to undergo surgery. The pain was unbearable, and the doctor prescribed opioids to help Jane relieve her pain. Her body was quick to get dependent on it, and ever since she has been taking opioids to prevent any withdrawal symptoms. She was unaware of the risks posed to her baby through her use of opioids, and so she's continued to do so throughout her pregnancy.
Unfortunately for Jane, her baby Bella was born and diagnosed with neonatal abstinence syndrome, or NAS for short. This is a term that describes a collection of withdrawal symptoms that arise when a newborn is exposed to certain substances, such as opioids, in the womb before birth. To clarify, opioids are drugs that travel through your blood and to your brain and cause signals that muffle your perception of pain and increase feelings of pleasure. The most common cause of NAS is opioid usage, such as heroin, the use and misuse of prescription painkillers, but it could also include antidepressants, nicotine, caffeine, and even alcohol. So what should Jane expect when her baby is born? Well, the reality is that NAS is a very complex disorder where the signs and severity vary greatly amongst different infants and even in the same infant over time. In fact, one can think of it as the symptoms existing on a continuum where timing of exposure during gestation, aka pregnancy, maternal stress associated with opioid use, poor maternal nutrition, or lack of medical or obstetric care can all affect the fetus and the intrauterine environment and consequently the symptoms of NAS that end up manifesting. So let's take a step back. We know that NAS is bad and we know it leads to signs and symptoms that are diverse, but why? And what even are these different signs and symptoms? Well, to understand that, we need to understand what normal development looks like. In normal development, one forms a more integrated and diverse form of self-regulation as they grow, a skill that is vital for both the baby and the mother to monitor both their own and the other's behavior and responses. There are 4 behavioral subsystems that help the infant interact with the environment. The first is autonomic control. This encapsulates things that you cannot control, such as your heart rate and breathing. The second is motor and tone control. This encapsulates muscle movement and the proportion of your body that is made up of muscle. For example, this system would help with the development of the muscles in your leg that help you walk. The third is state control and attention. This encapsulates the development in the amount of attention and ability that you use to focus. The fourth is sensory processing. This encapsulates the way that you take in information using your senses and are able to interpret the world. Hence, development of your vision is an example. However, in NAS, development of one or more of these behavioral systems are disrupted. This causes dysregulation or an imbalance between these 4 systems that translates to the various symptoms that can arise in each individual case of a baby with NAS. For example, an opioid-exposed infant could have extreme development in the motor and control system, which can lead to the development of too much muscle and hence difficulty for the baby to move due to the resulting stiffness. However, as a result, this baby will not be able to spend as much time developing in another system, such as perhaps attention, and hence be unable to focus and be hypersensitive to stimuli. To provide context, this could manifest so that they have difficulty achieving a quiet, alert state that is necessary for feeding, and hence this would result in weight loss. As you and Jane have started to realize, there are a whole variety of combinations of possible symptoms and signs that can arise due to the several combinations of systems that can be under or overdeveloped. This table by Jansen et al. Depicts this complicated interplay between the 4 subsystems and some of the symptoms that can result. Feel free to pause this video at this time to take a more comprehensive look. So why should we care about NAS, aside from the horrible symptoms these newborns have to experience that often last for the entirety of their development? Unfortunately, the reality is cases like Jane and Bella aren't all that uncommon. As this graph depicts, across Canada between 2010 and 2020, there were a whopping 16,920 total NAS hospitalizations. That's a 73% increase from 2010 and a 5% increase from 2019 when looking at 2020.
Now that we have learned about what NAS is, let's talk more about how Jane's pregnancy is progressing.
In Jane's case, her reliance on opioids to manage the pain from her injury and continued use in order to discourage withdrawal may have led to opioid use disorder. Opioids pass through the mother's bloodstream and cross through the placenta, which is an organ that develops in the uterus during pregnancy as a structure to provide oxygen and nutrients to a growing baby, effectively reaching the developing baby. Even before Bella was born, Jane's use of opioids could have had a plethora of implications on Bella's development. A study done with over 112,000 pregnant women found that opioid-exposed infants were more likely than unexposed infants to be born at a low birth weight. Other studies have found a link between maternal opioid use and congenital defects, with oral clefts, ventricular and atrial septal defects, otherwise known as holes in the walls of the heart, and clubfoot, which is a condition describing foot abnormalities that cause it to be twisted out of position, as the most common ones. Moreover, opioid use during pregnancy can also lead to a higher risk of miscarriage and maternal death, and has been linked to poor fetal growth, preterm births, which mean birth before 37 weeks of pregnancy, stillbirths, and other birth defects. Dealing with opioid use disorder while pregnant can be an extremely difficult situation to navigate. Even if Jane had been informed of the risks posed to her baby and the possibility of neonatal abstinence syndrome when she was already dependent on opioids during her pregnancy, she would likely not have been recommended to quit the drugs cold turkey. Quitting suddenly can cause severe consequences, such as fetal distress, preterm labor, and miscarriage. In fact, current clinical recommendations include treatment using medication for opioid use disorder. However, the first-line therapy agents encompassing medicine for opioid use disorder are methadone and buprenorphine, which themselves also lend to expected neonatal abstinence syndrome within the baby upon birth.
Now that Jane has given birth to her baby Bella, what is next?
Now, to find out if Bella indeed has NAS, a drug test would have to be performed on both Jane and Bella. The drug test will also help determine the type and drug dose that is active within Bella's system. Normally, drug tests are done using blood, saliva, or urine, but for newborns, the preferred method is to use umbilical cord tissue or meconium, which is essentially the baby's first poop. After the drug test comes back positive and Bella has officially been diagnosed with NAS, her symptoms will be recorded using a scoring system to determine whether she will need any type of medicinal therapy. Amongst many scoring systems, the most common and comprehensive is the Finnegan Neonatal Abstinence Scoring System. The Finnegan scoring system is a 31-item scale that is used to measure the severity of NAS and is a guide to possible treatments. Each NAS symptom is given a numerical score between 1 to 5 depending on the severity, and Bella will be scored every 4 hours until she is stable. Normally, infants scoring above an 8 are recommended to receive medication to help their symptoms. In the meantime, Bella will have to stay in the neonatal intensive care unit, otherwise known as the NICU, until all her symptoms have subsided, the drug has left her system, and the physician has decided she is stable enough to leave. As Bella grows up, she is likely to experience a multitude of challenges, including sudden infant death syndrome, growth problems including difficulty gaining weight, deformities of the head and face, heart defects, as well as hearing and vision problems. She could also experience other ailments such as seizures and significant cognitive, social, and motor development delays. Some studies have even shown that children with NAS are more likely to later get diagnosed with mental health concerns such as anxiety, depression, and ADHD.
Ultimately, how can Jane help her daughter Bella? Since Bella is having trouble feeding and is dehydrated, she may need to be fed extra calories through high-calorie baby formula and may need IV fluids. However, Bella may also require medicine to treat her severe symptoms such as seizures. She will most likely be given the same family of drugs that she was exposed to before birth. Once the signs of withdrawal are controlled, then the amount of medicine will be slowly decreased, ultimately helping Bella wean off the drug. As you may have learned today, neonatal abstinence syndrome is complicated and impacts the baby in adverse ways. If you are thinking about getting pregnant or are pregnant, the best way to prevent NAS is to not use NAS-associated drugs throughout your pregnancy. However, if you are taking those drugs and are currently pregnant, talk to your healthcare provider. Quitting drugs at once can also cause serious problems for you and your growing baby, and therefore alternatives may be recommended by your doctor. It is always good to be informed, as prevention is definitely better than a cure.